and describe the e-risk considerations associated with email. George Bernard Shaw stated, "The greatest problem with communication is the illusion that it has been accomplished." Much of the data that we have about provider-patient communication indicates this is indeed a true statement and a true concern. One of the key reasons that it's always worth remembering about the lack of communication being accomplished in healthcare today is what we call health literacy. I'm not talking about the ability to read and write, rather the ability to understand and process information. We know that about 20% of Americans today read at the 5th grade level, yet we seldom gear our instruction sheets, our forms, and our discussions with patients on this basis. We can never underestimate the power and importance of communication. The Doctors Company participates in a claims data gathering program developed by the Harvard Risk Management Foundation. All of our closed claims information is entered into this system, which has given us a huge amount of data about claims. What we're seeing is that communication is an issue in more than 50% of claims when examined by our nurse analysts and evaluated according to clinical taxonomy. The communications issues arise in dentist-patient communication, dentist-staff communications, and dentist-to-dentist communication. Even patients recognize the importance of this. We've done some surveys on patients who initiated litigation against providers, asking what were the causes for them feeling the need to begin litigation, and in more than 35% of the cases, communication is listed as a significant factor. We also suggest that you remember that you are communicating in some manner with patients in about 60 to 90% of the time that you are functioning in your practice. We know this is certainly the electronic age. It's around us everywhere. 40.9 million Americans accessed the internet last year for healthcare information and services. There's a growing demand for specific information about various medical and dental conditions, as well as information about medical and dental providers. More and more patients are demanding the ability to communicate online with providers. Some research from Cyber Dialogue indicates that the demands of patients or potential patients are a significant part of what every medical and dental practice is going to have to consider when evaluating the extent to which they wish to interact electronically with patients. In reality, how you choose to handle these communications can impact your market share. 14.8 million people indicated in surveys in the last year that they will switch to a dentist to gain website access. 11.9 million said they would change dentists to get one who communicates via email. And 3.7 indicated they had already communicated with their dentist by email. And 3.2 million indicate they are already accessing their dental office's websites. So we can see that this is already here, already upon us. One of the first things we have to remember when we're talking about this is what's all the hype about HIPAA. An acting United States Attorney General was quoted in the LA Times as noting that HIPAA criminal privacy provisions protect not only celebrities, but all of us from curious neighbors, disgruntled coworkers, and other snoopers. The point that I'm making here is for us not to forget that not only can you be sued by the patient for any privacy breaches, but you're subject to investigation under federal laws. And the penalties now include not only fines, but they can also carry the possibility of criminal prosecution. There was a well-known case involving an anchor woman in the Little Rock area who was savagely attacked in her home and was rushed to a hospital clinging to life. The medical director of the hospital accessed her medical record from his home without having any medical need to do so, as did 2 other hospital employees. These breaches were investigated. The medical director and 2 hospital employees were fined personally, and all had imposed community service hours to perform. You probably remember the famous Octomom case. In that situation, the healthcare system was fined and numerous employees were fired due to inappropriate access to protected health information. So the bottom line is we have to remember always our obligation to protect healthcare information and to recognize that in this electronic age, there's so many more ways for breaches to happen. Here's some 2011 examples. There was a national pharmacy chain that disposed of prescription and pill bottles with personal health information in just an industrial trash container that was accessible by unauthorized people. That chain was fined $1 million. In Alabama, there was a woman who was visiting a patient over a period of several days in the hospital, and she stole several days' worth of surgery schedules that included date of birth and social security numbers because she planned to use that for identity theft. Thank goodness she was caught before she was able to do that, but she still faces 10 years in prison and $250,000 in fines if she's convicted. In Massachusetts, a Mass General employee left some documents on a subway train that included personal health information on 192 patients. The hospital was ordered to develop a comprehensive set of policies and also ordered to pay a $1 million fine. So we need to pay special consideration to this. When considering the various risk implications of electronic communications, the best advice is develop a policy and procedure, adhere to it, and assure that all staff in the office are doing so as well. And it's also important for us to remember there are going to be patients in your practice who do not wish to communicate electronically, and we don't want to ignore those people or leave them out. For example, many dental offices uses email as a reminder of you have an appointment tomorrow morning at 9 with the dentist, with these reminder appointments. If a patient doesn't have an email address or prefers not to be contacted this way, then find another way, going back to the old-fashioned telephone calls, to be sure we don't leave out those patients. When it comes to your practice site, you are responsible for the information that is contained on it. So be sure that whatever information you put there is accurate and that it's up to date. And one of the things you want to do is to monitor it periodically. Be sure that any advertising or marketing materials do not set unrealistic expectations and that the content does not in any way include a guarantee or an implied warranty. Post a disclaimer if your site provides links to any third-party sites, and as part of your website monitoring, be sure that those links stay current. So you'll want to go in and check, does the link still take you where you think it takes you, and is that information that you still want to be affiliated with? And if the website includes a patient portal, post a disclaimer about the limitations of this form of communications. For example, it should never be used in case of an emergency as a way to reach your dental provider. If you or the practice are going to have direct patient communication electronically, be sure to obtain the consent of the patient. Be specific and clear about what will be involved in this electronic communication. Will it simply be appointment reminders and maybe patient satisfaction surveys? Might it include the ability to make appointments online or the ability to complete a history form? Will it be that you download it and then the patient brings it in, or will they be able to complete it electronically and communicate it to you electronically? Also determine if you're going to be having personal email as a provider directly with the patient, if that's going to be part of your communication. Employ suitable safeguards to prevent unauthorized access to your computer system through which this communication will occur. For example, every staff member should use only their password. They should never use yours or never use anyone else's. Sometimes in a busy office, it's real easy if somebody's logged in, oh, let me just access your computer, don't log out. But we want to be sure that we're very strict about access to these kinds of systems. We encourage you to limit your electronic relationship to patients you have already seen. We encourage you also to obviously employ electronic security measures and to use a system of authentication. For example, the most commonly used one that I've seen is the use of PIN numbers. And the point here is you want to be sure that the individual with whom you're communicating is indeed the patient that you believe it to be. Make this a requirement and make it part of all of the communication that you have with individuals. Include this authentication process in all of your communication. We want to also be sure that we're conducting our exchanges over a secure network to the extent possible, and we need to be aware of the fact that standard email does not meet HIPAA requirements. So if you're using it, you're going to have to employ a disclaimer about the fact that this is not a secure network and we cannot assure the privacy of information that is transmitted in this fashion. Keep a paper or electronic record of all communications that you have with patients. If you're using paper records, then what you'll want to do is to print out any emails that you've had with patients or any communications that you've had with patients and include it in your paper record. If you're using electronic medical records, obviously it's very easy to import any of these electronic communications into that system. Once again, you want to be sure that you're discouraging the use of online communication for emergencies and have a disclaimer regarding this. You don't want a patient trying to reach you saying, that work that you did on my tooth yesterday, I'm running a fever, the area is reddened and swollen. You don't want them trying to contact you about that sort of thing using electronic communications. You also want to be very careful about using, discussing or talking about any sensitive information in electronic communications, especially those like email where it may or may not be secure. So for example, if you are treating an HIV positive patient, that kind of information would not be appropriate to be discussing in a non-secure environment. We also would encourage you to be very careful when a patient has a new condition. You may have been seeing them for one thing, but if they begin electronically communicating with you about a new condition, be very wary about diagnosing or treating a new condition relying solely on this online communication. Remember, there's no substitute for seeing the patient and laying eyes on that individual when diagnosing and prescribing. Another tip is when you're responding to a communication, always include the original communication as part of your response. In this way, your answer can't be separated from the question that was asked. Sometimes there's an effort to distort information that you have provided, so you can tie it back together if you're sure to copy the original request or include the original communication when you are responding to an electronic communication. Let's talk a little bit about social media. Large healthcare organizations sometimes employ social media managers who, according to Kevin MD, can make between $60,000 and $80,000 a year. Clearly, this is a big business. When we look at all these avenues for social media, these are largely used as marketing tools. They're a great way to provide and communicate events relating to your practice. They're a great way to offer consumer education. However, the caution is social media is not the best way to communicate certain kinds of information, and it's not appropriate for exchanges between dentist and patient. First of all, it's not consistent with HIPAA privacy practice requirements. There's the potential for breaching professional boundaries. Sometimes patients and sometimes providers don't always understand the purposes of the sites. So our best advice is don't discuss individual patients and don't communicate directly with patients in this setting. Be careful not to dispense specific dental advice and don't respond to specific questions from individuals. In other words, don't try to practice dentistry in the social media setting. It's okay to provide advice on a topic. Perhaps you've been asked to say a few words about a particular condition. That's great. Be sure your information is accurate and up to date, but end it with a comment along the lines of, please consult with your dental provider for guidance on your specific issue. We've already had a case that talks about defamation, where a physician has gone after a patient for defamation in the social media setting. I'm thrilled to tell you that it was not a dentist who was involved in this. In this particular case, a physician filed a defamation suit against a former patient who was bad-mouthing the patient on Yelp and other review sites. The doctor's attorney noted that the critical comments had been reviewed by hundreds, if not thousands, of consumers and prospective patients. However, the consumer prevailed. We're not at all surprised by that. And in this particular case, the physician was ordered to pay $20,000 in attorney's fees. This is the first such case we've seen. It's probably not the last, although we don't really expect any difference in terms of the outcome. So be aware that your patients have the upper hand when we're talking about social media. But let's look at some ways to reduce your risk. Be sure that you provide a forum for patients to give you feedback, especially make sure they know how to make a complaint. And the fact that you welcome, if things didn't go the way they thought they should, please tell us and let us try to fix the problem. Let them know who they should speak to, whether it's you as the provider or it's your office manager. But be sure everyone knows if you have a complaint, please tell us about it. Also, we recommend providing a patient satisfaction survey mechanism and pay attention to the feedback that you get from your patients. Use it to improve the relationships. You might also find it helpful to monitor some of the internet sites, the social media sites that your patients might be using to post comments so that you're not caught off guard if a patient goes on a rant. You can certainly contact the internet site to find out the process for challenging a negative comment, but often that will not be possible. Do use great care in attempting to rebut a negative posting, as it can backfire very quickly, as we've already seen by this case where the physician attempted to sue the patient. Your professional liability carrier can help you with sorting out what would and would not be an appropriate response in this kind of setting. If your carrier is the doctor's company, this is the advice that we give that is the only appropriate response that we think should be posted. And basically, it's a very generic posting that says the physician is precluded from commenting specifically regarding patient treatment in public or other social media sites. However, the doctor is always available to discuss patient concerns directly to achieve a satisfactory resolution, and individuals are welcome to contact Dr. X's office. In our view, that's about as far as you can possibly go in this kind of setting with social media. Now, when we talk about electronic communication with patients, we can't forget about mobile devices. Everyone's got smartphones, they've got tablets, they've got laptops, and there's some risks associated with this. First of all, you need to think about how easily all of these mobile devices are to lose, to have stolen. They too can be subject to malicious attacks from malware and from viruses. And they're particularly at risk when you're using a non-secure Wi-Fi connection. We typically use these devices because we're on the go and we're on the move, but remember, they're especially at risk when you're using that non-secure Wi-Fi connection. So if you are going to communicate with patients or convey patient information using any of these mobile devices, you want to be sure that you install and enable encryption. On a phone, that's going to be information that's stored at rest as well as what is sent in motion. You're going to want to enable screen locking after inactivity so that someone else can't pick up the device when you have turned your head and access the information. Use a password or authentication. Install or enable remote wiping or disabling so that in the event that this device is lost or stolen, you can immediately take steps using another device to delete or wipe the information that is on that device that was lost or stolen. Use appropriate firewalls, of course. That would be true for anyone with any kind of electronics. Finally, to manage your e-risks, have a written policy and a procedure and train your staff and let them know that your expectation is that they will follow these policies as well. It's always smart to appoint a privacy officer for the practice, someone whose job it is to be as expert as possible and keep up with all of the HIPAA changes and postings. You would be wise to use some mechanisms that are available that will block emails from your non-patients. In other words, if they're not in your directory of known patients where you have that patient's consent to have electronic communication with you, that you won't be getting emails. This will keep you from having an electronic dialogue with someone who isn't even your patient. If you use an EMR, be sure that you know what your EMR system does. Some of these use forms to elicit information from patients, and sometimes it goes beyond what you had ever considered that you might want to know, information about depression or substance abuse and that sort of thing. So be sure you know about some of the activities on your EMR and know whether those are turned off or turned on, and if any of them are things that you don't want, be sure they are turned off as an unwanted option. And remember that smartphone and email records are discoverable in litigation. One more issue to be concerned about and to bring up is that many patients today have what's called PHR, personal health records. These are owned by and controlled by the patient, not the provider. Sometimes they're a quick way to get information about the patient's history or their medication list. Sometimes patients carry these around on a flash drive, or they may have access to them electronically, or they'll bring them in paper. But these are not a substitute for your history taking. Presumably, you have a history form that you have confidence in that elicits the information that you want and need for your dental practice. So you're better off not going down this road and instead recommending that you get the information your way using your forms. Now, you should check with your professional liability carrier about any options on coverage you might have that would address electronic risks. And the reason I bring this up is the doctor's company has created a coverage that we call CyberGuard. And it helps providers in protection from regulatory and liability claims arising out of the theft, loss, or accidental transmission of protected information. So the odds are that if you're not insured with the doctor's company, check with your professional liability carrier to see if they can offer a similar product. In today's world, this can be so helpful because not only does it provide this coverage, but it provides you with access to a ton of resources relating to how to handle a data breach and that sort of thing. The doctor's company is very proud of the fact that on our website, www.thedoctors.com, we provide a ton of resources. Most of our resources are not behind a member login, and we do have under our Knowledge Center a section called EHR and Telemedicine, which can provide a lot of information about the subject of today's webinar in terms of electronic communication. Our mission at the Doctors Company is to advance, protect, and reward the practice of good medicine. So please check our website for information.